Social media and healthcare. Social media is a tool that we can use to transform healthcare. The future is already here. This session's about the future of cardiovascular medicine, but the future's here. We all have phones that have amazing power. They can tell us what our heart rate is. They can give us a real-time EKG. They can tell us our respiratory rate. They can assist us with clinical research now that we have the research kit from Apple. The iWatch is going to be an amazing tool. We can track calories burned. We can determine how many flights of steps we've climbed. The future's now. We have to embrace it, and we have to lead the way. We're connected in this world. Whether you like it or not, we're all connected. We're connected from here to London, to Manila, to Hong Kong, to Australia. We're connected. There's many platforms by which we're connected. We can be connected by Facebook, by Twitter, by YouTube. Blogging is a way that we can share ideas and motivate patients, colleagues, and other professionals to take control of their own cardiovascular health. These tools are incredibly powerful. For instance, Twitter, the little bird, actually affected the stock market 2 years ago in a way we've never seen the stock market affected. Someone hacked the AP Twitter account. They said that there was an attack on the White House and that they did not know whether our president had been injured. You can see on this slide that there was an enormous amount of trading within about a 3 to 4 minute time frame, and the market plummeted. Fortunately for the market and for those that were invested in the market, this normalized very quickly because the AP was able to get out and say, this was a hack, this didn't happen, and they gained control of their own Twitter account. So we have all this power and all these tools at our fingertips. But what we do with this power and what we do with these tools is what we're here today to talk about. I want to tell you a story. This is Dr. Gia. Dr. Gia is a wonderful, dedicated physician, and she treats patients outside of Manila in the Philippines. She's a general internist. She has limited resources. She cares deeply for her patients. In fact, she became a patient herself in the last 10 years when she developed breast cancer and was successfully treated. Dr. Gia is, again, from the Philippines, a collection of islands, lots of remote places. The healthcare there is not like it is here. The resources incredibly limited. They have to do more with less. She doesn't have access to the specialists that we have access to. She has to read, connect, and reach out for information. I met Dr. Gia virtually through Twitter in 2009 when she joined Twitter. She and I just happened to connect by random chance. I may have tweeted out an interesting tidbit from an American college meeting or as an electrophysiologist from a Heart Rhythm Society session. And she latched onto it and retweeted it and responded to me and said, you know, that's really interesting. Can you tell me more about it? We developed a relationship. I got to know her and her staff. I've never been to the Philippines. I've never been to Manila. I've never met her in person, but we're dear friends. This is a picture of her very, very dedicated staff. They work day and night to take care of these very poor people in the Philippines that have little or no access to health care. We engaged. This is what this is about. This is what social media is about, engagement and making a difference. This is a slide from my iPhone or my iPad, I can't remember which, where she reached out to me via direct messaging, which is sort of like being the wizard behind the curtain, where not everyone can see you when you have this direct message conversation, but the person that you're having the conversation with can. She knew that I was an electrophysiologist, and she began to develop a practice that had lots of patients with heart rhythm disorders. And she really would try to pick my brain about who to send to Manila, to the big hospital, and who to send elsewhere, because they had so limited resources and such limited access that she wanted to be a good steward of their healthcare resources. And so we developed a relationship where we became colleagues. As a primary care doctor may stop me in the halls at UNC and say, I've got a patient with atrial fibrillation. Can you see that patient, or what do you think? Almost like a curbside consult. But the difference is, then you take action. We engaged. We got to know one another, and then we engaged. Let me throw one thing in about the elephant in the room and the HIPAA regulations. HIPAA does allow for us to exchange privileged healthcare information with another doctor for treatment purposes, but you have to keep it quiet. It can't be broadcast mainline. That's why a lot of these direct messages were okay. So it became personal. Dr. Gia reached out to me by direct message one night and said, Kevin, my dad's really sick. He can't breathe. He has, poor blood pressure. His heart rate's in the 130s. I think it's atrial flutter. What do I do? And so I said, well, if he has this problem, let's get him to whatever emergency facility you have. Let's make sure that if this is atrial fib or atrial flutter, we anticoagulate him. We do things to slow his rate down. We need to know what his heart looks like. Let's get an echo. And so she did that. And then she said, well, what medicines does he need? What do we need to do for him? And so I gave her some suggestions. Then I started looking for electrophysiologists in the Asia-Pacific region that were skilled in atrial fibrillation ablation, because that's what her dad needed. Unfortunately, he had a TEE that showed a huge left atrial thrombus, and not much could be done for rhythm control at that time. Ultimately, they anticoagulated her dad, and they were able to, when it was safe, do an atrial flutter as well as an atrial fibrillation pulmonary vein isolation procedure. They waited. His EF of 15% never got better. 6 months later, he was implanted with a defibrillator. What happened? Well, Dr. Gia's dad did really, really well. He began to thrive. He had a BIV-ICD. His heart failure improved. His EF improved. Recently, and I think this was January, on my cell phone, again, she tweeted behind the direct message platform and said, I'm really scared. My dad's ICD is beeping. He had a Medtronic device, so I knew a beep meant there was some sort of alert. She couldn't get in touch with anyone to come interrogate her dad's device. She was scared. I contacted the international Medtronic telephone number and put them together. From sunset in Manila to sunrise in North Carolina, I was able to get a Medtronic representative to her dad's house. They interrogated the device, found that it was a non-critical alert, just needed some reprogramming, and that alert went away. But she was scared. What do I do? I was able to connect with a friend who happens to be a physician and help her in Manila from North Carolina, literally lying in my bed while I was reading a book on my Kindle, because God forbid we do anything with traditional print now. Gia and her dad are great now. He's doing very, very well. Gia loves social media. She is someone who inspires me to do more with social media, to reach out, to connect, to make a difference. Gia and I are planning an Asia-Pacific social media conference for physicians. We're working in the planning stages of that now. The bottom line is, connectivity through social media shrinks the size of our world. It shrinks the earth. It brings us closer together. The Philippines, and if you put a dot in the middle of the United States altogether, is 8,000 plus miles. I was able to interact real time with a real doctor in the Philippines and become her friend and to share what I know about heart rhythm disorders with her so that we could treat her dad. The time is now to get involved. Social media is one way along with mobile devices, along with electronic patients, along with mobile health, that we can affect the way we engage and treat and assist those in our world. So now we're going to move to the next part of this. We have some wonderful panelists here, and we're going to have Christian Gardner.